That's a combination.
That's my brother Stephen Mbide largely talking to those disgruntled border riders who were actually aggrieved after the death of one of their own who was knocked by a car. And it just so happens that the same person who passed away was being chased by a patrol car. Yes, that was implementing SOPs. That individual was carrying a passenger, so he was being chased down by that car, but he was knocked down by another that was coming in the opposite direction. The border riders actually said they did not take this gentleman to the hospital simply because it was not they're doing, and that's something that is callous. If someone is actually in a bad position, you help them. You do not say it is not us that caused it. It is the police officers that caused it. So let's leave him to die. He's one of your own. You should have done whatever you could have done to send him to take him to a hospital and get some help or treatment in that regard. My name is Rome Busiku. I have Robert Kwesiga. He is the Secretary General of Uganda Red Cross Society. We want to talk about how Uganda Red Cross Society has been managing throughout this COVID-19 pandemic, what kind of activities they've been expediting during the same, and what the future looks like for Uganda Red Cross Society. Very good morning, sir. Thank you for joining us.
Good morning to you too, and good morning our viewers.
All right. From this perspective of Uganda Red Cross Society, how is the COVID-19 pandemic affecting Uganda?
I think, to put it blunt, it is not good. It is not good in the sense that we have lost our dear ones. A good number of our country people, relatives or friends have been infected by this pandemic, so they are either at home or in hospitals. All of us in one way or another, we are being affected by this pandemic, whether directly by losing the dear ones or the people we are caring for, but also the socio-economic impact it has created on all of us. So the situation is not as good.
What about the good work you are doing at Uganda Red Cross Society? How has it been affected by this COVID-19 pandemic?
It overstretches us.
Indeed.
It overstretches us in a sense that there is a lot that we can do, but then we don't have sufficient resources to carry out all our mandates to the latter. Yes.
Go ahead.
Now, I think viewers and my friend, we have to, let's take it back to last year. Last year when
The
COVID
first
was the first lockdown in the country,
Indeed.
and when the COVID became a reality in this country, you could easily isolate the COVID cases. And that's why it was easy to man the border entry points. That's why it was easy that whoever gets infected with COVID would be taken to a medical facility and isolated from the public. And so through that, you could easily trace the contacts, but at the same time, the person already infected would be under the ambit of the medical services. Now, the situation has since evolved to an extent that every community now, in almost every part of the country, COVID is present. And so you can't use the same methods of last year
Contact tracing.
to manage it now. So, and that's why you find that on one hand, there is increased demand on medical services because the cases are many compared to last year. But also it has become more complex because the young people last year, or people of young age, were not as impacted as it is now. But also it has come with a vengeance because of these other strains,
The Delta variant.
which the public is aware of. But on the other hand, is not every case must go to a medical facility. And that's why the whole question of home-based care, the whole question of community engagement comes into force. And so, as Red Cross, last year, we are working with the government at border crossings. We are working with the government in doing screening at those locations. We were, our ambulances were purposed at those areas to evacuate and take people to those medical facilities. Today, our main shift is, our main focus is how do we work with the communities? How do we work with the communities to educate, to do risk management, to do case tracing, and where the person needs specialized medical care, then that person is evacuated to the medical facilities. And that's the way to go.
Indeed.
Because it is, let's call it a community pandemic now. That's the way to go now. And so as Red Cross now, we find community engagement
I hear you.
is the key. Our ambulances have been repurposed to that effect. And also there were some other things we did last year, like food distribution, where we were working with the government, which now have been repurposed into cash transfer. So it makes it a bit, we take a backside position. I'm sure you're not seeing us like it was last year, where we are at the front line.
Indeed.
And of course, in between, we shouldn't forget that there are other emergencies which we carry out and have been impacted by COVID.
What kind of emergencies?
I'll just give you an example. Blood. The need for blood. So blood, whether there is COVID or no COVID, the children who suffer from malaria need blood, the expectant mothers need blood, people who get accidents need blood. Someone was telling me that no accidents have reduced because of lockdown, but lockdown is only 40 days now. But even when I entered, I saw
just now, indeed.
So the accidents are still there. Now, we have shifted the focus, and it has worked, by the way, and we're excited about it, in a sense that we used to focus on getting blood from schools,
yes, Robert,
and institutions of learning. You know, it is a bit easy. They're organized, they're in one location.
You just have to go to this institution and carry out the blood donation.
But now, for almost 2 years, the schools aren't there. And so we have taken blood donation to the communities.
How so?
Yes.
How are you protecting yourselves to not contract COVID-19?
Have you heard that there is blood shortage in this country?
There is a blood shortage. How are you, making sure that you protect the people who are targeting these individuals in the communities?
It is not there. Do you know why?
Yes.
Because we have used the community networks, the community approach. And the members of the community, wherever they are, they have responded positively.
It's about saving lives.
And they're giving us blood. And for us, together with the Ministry of Health, we're excited that this is a big breakthrough in terms of blood sufficiency, in terms of blood sustainability. So I thought I should mention that.
Indeed.
Two, this hasn't stopped disasters happening. COVID hasn't stopped disasters happening. So floods, and we're entering another period of likelihood of high floods.
We have some people living around the River Nyamwamba Basin. They're also grappling.
There's a case of the Kasese area. And so, when people are displaced,
I see.
Then how do you observe SOPs? How do you save lives? And how do you make sure that these people are supported?
Must have been tough for you executing all these projects during this COVID-19 lockdown.
So now, then you have talked to refugees. Refugees now, there are new entrants coming. I think you must have heard those from Bundubuju area.
Indeed.
But also, they equally suffer COVID. So, in other words, it is complex when you look at it from the humanitarian
angle. So you have to handle COVID, you have to rehabilitate the refugees, you need to handle blood donation drives in the midst of a travel ban. Robert Kwesiga, you're doing the most. You're doing the most during this lockdown. Go ahead. What kind of challenges have you encountered?
I think the challenge is larger around, you see, all this is happening around amidst a global economic downturn.
Indeed.
So there's a global economic downturn. And Uganda, of course, it also impacts on us. And so the question of resources is broad. It's not limited to us. It's sufficient resources. Now, it becomes more complex that even those who would be helping us with resources are equally affected.
So they had to scale back the resources.
They scale back.
Like what we saw in the refugee settlements, the food rations going down when UNHCR, cutting down the food rations.
Those budget cuts.
I see.
I can compare again with last year. Last year, when the government made an appeal, and even Red Cross, we got good support. Because government, besides those who are donating directly to government allowed Red Cross also to be a recipient of these donations.
Nice.
And we got huge support. The question would be, why are we not getting the same support this time around?
More people have fallen into the vulnerable bracket.
Yes,
They are not
because
donating.
the
Uncertainty over how
the
this
movers
long
and
this
shakers of the
breakdown.
economy
Yes.
have also been impacted on. And so the disposable income they can use also to do humanitarian work
Indeed.
has been curtailed. And that's the situation we're working in. But you see,
Don't you think the nationalism we are seeing on the whole global stage is something that is actually affecting your work? Robert Kwesiga, the fact that you do have all these first world countries that were actually engaging in these humanitarian activities, and then when the COVID-19 pandemic hit and they were also grappling, they said, no, let's look at cutting the budget. Where are we spending too much money? Then they'll go to Africa. They're like, okay, the refugees. Then they start cutting, and then they start cutting. Do you think such nationalism actually affected your work, the stakeholders with whom the international partners are working in the African context? The fact that when they cut funding, you're also affected in that regard, Robert Kwesiga. Don't you think that is the problem we are dealing with right now, nationalism?
I think partially, I would say partially.
Because I was talking to some people from UNHCR, and they were saying we shouldn't have cut funding for the refugees. We should instead have levied more money to the refugees instead of these cuts.
You see, there is a question of the economic downturn of these, the so-called strong countries.
Yes, Robert.
That normally support such causes. But also, don't forget, there is a shift in the political thinking of the leaders in those countries. But also, on the other hand, it becomes a wake-up call. A wake-up call. To what extent can we do some of these ourselves? I'll just give an example. If we are talking of home-based care, because I would want to shift it back to COVID. If we are talking of home-based care, whom are we talking of? Is the local leaders, the LCs. We are talking of all these, the village health teams. We are talking of Red Cross volunteers. And what do they need to do that job? Maybe the basic information materials, maybe the protective gear. Yes, there are those which are expensive when you go into medical services, ICU, oxygen, and all that. So, on one hand, there is that aspect that, in as much as you're a global village, you know, they always say that you can't support your family based on your neighbor's generosity. It has a limit. And I think that's one thing we need to think through.
And you're also helping with the barriers here in Uganda. How did you train?
Come again?
You are also helping with the barriers. Did you train enough?
The barriers, the policy was changed. You know, at first, COVID being a new pandemic, there has been fresh studies and adjustments on the SOPs. So at the beginning, the question of COVID, the dead bodies, the position was for safe burial of these bodies, you need people trained, you need the specific SOPs. And the Red Cross, we had been given that assignment. And we drew it from Ebola, because we had taken charge of Ebola burials, especially in Western Uganda, which had been with us for over 2 years plus.
Okay, Robert.
Now, science in due course recommended that it is not necessary to do it that way. What matters is how do you make sure that the body is not exposed to the people around, and that's why you hear of the dead body bags, where the person is put in a body bag, but also the people participating in the burial, observing the SOPs.
Yes.
Not being in touch with the body, but more of how do they keep social distance, how do they put on masks, how do they wash their hands, how do you minimize the numbers of the people who come for these burials. So you find that now with dead body management, it is more of the people who come to be associated with the funeral processes on how they protect themselves,
Indeed.
not necessarily the body as the main focus. So long as people don't touch the body and is that
There was that problem of the rituals, washing of the dead bodies by members of the community, which actually led to the spread of COVID-19.
So if you don't touch the body and the people who come for burial keep those SOPs, that's good enough.
All right, we are about to get out of this lockdown. What tips do you have for Ugandans? But largely, before you give us any tips, let's talk about how this lockdown has affected the refugees and Ugandans as a whole. What have you noticed as Red Cross? Vulnerability levels going up.
For Ugandans, we who are in the humanitarian world, and you can't separate the economics and the socio-economic impact.
Indeed.
Because the two are intertwined, and the end result is creating a humanitarian situation.
Indeed.
And we can see it happen. If so, a number of people are losing their jobs. If people are having this psychosocial impact, these are things which are a bit silent, but they are killers. The psychosocial impact of COVID on individuals. You have lost your dear one, you have lost
Issues
your job,
of mental health.
you have lost your livelihood. That becomes a humanitarian challenge. But then, on the other hand, and I want to emphasize this, the climate change is real and getting worse.
I hear you on that one. But how is it affecting people during this lockdown?
One can say, that's not COVID. But so here you are, you have COVID. But the climate change, the way we are managing it, is not getting better, it's even getting worse. And globally, emergencies, disasters which are climate related are on the increase. They are not going down. So the humanitarian interventions, because of that, are escalating upward. And so we can talk of COVID, but what about those related aspects? And when they interface with COVID, the spark that they create. So that is key. And you find that as Red Cross, then it is like, what do we do? In terms of climate change mitigation, in terms of real-time response, but also now, COVID coming into the picture. I think the refugee situation, I would say, it is largely around the pressure it puts on our natural resources, which is again climate change.
Cutting down of trees for charcoal and so forth in the settlements, clearing the same trees to just settle and build some houses.
But also the pressure it puts on the Ugandan economy, because the less international support you get, then the pressure is deflated to be absorbed by the host country. And in the process, then the refugees are adequately catered for, not adequately catered for, and then they are short of the basics. So then it becomes a compounded problem.
All right, now let's give people some tips, the Ugandans, during this lockdown.
You know, COVID, all predictions say that it is with us. So we can't say tomorrow it is ending. It is with us for a while. Two, I heard the minister yesterday, she was giving the scientific
General
aspect of it, and saying that during the rainy season, which we're about to start, October, November, the virus tends to thrive, meaning that we can easily have another wave if we don't do the basics right. And you remember last year it was the same story. And so I think it is around how do we take charge, first as individuals, as a community, and as a country. Each one of us, whether as an individual, whether as a community, whether as the whole nation, whether and government institutions and all actors, have a role to play. Because at the end of the day, the basics, if we observe the basics right, the SOPs we have been talking about, then you minimize the pressure you put on these facilities like medical services, which are overstretched. But on the other hand, the key, like they say, the key is around how do we get vaccines? how do we get the vaccines?
That is the biggest conversation. How do we get the vaccines? We've so far vaccinated only 1.1 million people out of the 21.9 million people, meaning reopening of this economy is largely basing on that fact, ramping up vaccinations. And many people are contending that government might extend this lockdown under that guise of actually allowing vaccinations to continue taking center stage.
And it goes back to what I said, that we live in a bit of a dual world. So if the vaccines, which are still insufficient in quantities globally, are being controlled by those who have more money than us, that's the situation we are in. And so I can see progress in terms of these vaccines being available and available to all of us, especially in this other part of the world. But I think the solution is around that. Because if you look at Europe, you look at America, they have started opening up because they have sufficient numbers of people who have been vaccinated.
They booked those vaccines that had been manufactured. Then they pre-booked vaccines that are yet to be manufactured, meaning there are no vaccines left for the African continent. That's why you see President Museveni, Dr. Diana Twine, John Luther Cheng are grappling left, right, and center. And of course, you did mention that we are at the mercy of these countries that do have money. And the viewer who's watching might be compelled to ask, if they do have money, why are they cutting the food rations? Why are they cutting the money that they've been using or sending to these humanitarian activities within Africa?
But before I answer that, I think that shouldn't make us cry and say we are dead and we are hopeless.
There is hope.
I think there is hope, and hope, as always, lies in prevention.
Indeed. Wearing of face masks, social distancing, discipline of
so
the SOPs.
I think our life-saving tool now, as the vaccines come, is how do we do the prevention? And we do it well. Then the vaccines will catch up. So we cannot sit back and say, we don't have money.
Let's talk about how we are egging on our Ugandans to adhere to the SOPs. Are we even egging them on? We are beating them into submission. Is that one avenue through which you can achieve behavioral change?
But
does it work? Because right now we are talking about discipline.
Government has put money there. So government has put up money to buy the vaccine. So it is not like we are saying, we are bearing on donations. Government has put up money to buy the vaccines. Now, the question of people being
clobbered into submission.
No, I think, this is my personal view. So
Indeed.
At times I sit back and say, what is it that makes us not take responsibility? Because this is about my life, this is about your life. So why would the policeman appear as if he minds more about your life, about my life, than the person himself or herself? And so I know there can be cases whereby when you are desperate and you don't have the means, it is like life no longer becomes variable. But I think personal responsibility. So enforcement, I think the enforcement now tends to be overshadow the personal responsibility, because the personal responsibility.
Should we have used people like the medical workers, people like yourself, the Uganda Red Cross Society, to actually help disseminate this information? As you go out there delivering emergency services, you can also egg on people to actually adhere to the SOPs.
Yes, and that's why I talked to you that as Red Cross, but also government has rolled out this community engagement, is the prevention and taking it to the community. Then people know that COVID is our problem as individuals and as neighbors and as a community, not for the policeman to remind you that COVID is a problem. I think that's where and I think it is taking root. It is taking root. Yes.
Before I let you go, Robert Kwesiga, what other plans do you have in the pipeline as far as Uganda Red Cross Society is concerned?
Regarding COVID?
Your future plans as Uganda Red Cross Society regarding the fight against COVID?
I think regarding COVID now is around what I've just mentioned, the prevention aspect.
All right.
using the community as the fulcrum for this. Then the people that need evacuation to the medical facilities, like I've said, all our ambulances, which were even for other activities, whether road safety, we have refocused them to COVID. Then we can be able to
nice.
save life. And then along the way, as the other measures we have talked about of vaccination take root, then also to ensure that, because also, you know, there was a bit of skepticism about vaccination. So the vaccination awareness, that this is the way to go. And you do away with the misconceptions about vaccination. So the focus is around that. Really.
What are some of those misconceptions?
You know, social media, good in giving us information, but also when abused is dangerous.
Indeed.
And I'm sure as someone in the media industry, there are all sorts of stories around on social media which try to campaign vaccination, which try to portray vaccination as another tool to decimating the African or the poor country.
Because it's not true that these vaccines can stop someone from getting pregnant. So if you are on social media and you're spreading this rumor, it is not true. Robert, go ahead.
Yeah, and by the way, part of what we do in the community engagement, we pick those rumors and bring them to the authority or the relevant
for debunking
and see how they can be debunked. So it is a continuous process. You cannot say now all of them are done with, and yes.
All right, how are you reaching out to these victims of natural calamities during this strict COVID-19 lockdown? People like in Kasese, how are you reaching them with this travel ban in place?
It becomes more expensive in terms of then how do you give them the PPEs, because they are displaced.
Indeed.
So they are displaced, they are living in a
makeshift.
In makeshift. So are they having access to PPEs? Are they having water? Water is key, by the way. Water is key. Water, soap, such that they can be able to wash their hands, because they don't have the privilege of these sanitizers which you have in cities. So that is key. But you see, you can easily tie it what I've just talked about of the community engagement.
Yes, Robert.
But if I'm in my community and I'm aware and I understand what the do's and don'ts of COVID, and then the displacement happens, already you have where to start from. You already have where to start from. So the Kasese case, that's how it has been treated. Like I've told you, we're expecting heavy rains again. So we are beginning to prepare. And these days we talk of disaster mitigation, we talk of forecast planning. What we mean by forecast planning, if I can spend a minute on that, is if the predictions show that this area is going to be affected by heavy rains, which will culminate into floods and, of course, the destruction of property. So the question is the public aware that something is going to happen? And when they're aware, how do you prepare them?
Of course, you've mentioned a very, very good topic, but before I let you go, are you still giving people life-saving skills as far as first aid is concerned?
Yes.
You used to do that in 2016. Is it still happening?
Yes,
and you could actually paint a picture using what just happened on Morning at NTV during Stephen Mbide's interaction with those border riders. They couldn't give first aid to their colleague. Are you doing the same?
We are doing it,
offering those skills.
And we are revamping it.
Nice.
I must say it had slowed down. We are revamping it. So, you know, we have over 20 ambulances which are being put on highways for road safety. But this is accompanied by first aid training, first aid skills, but also first aid equipment to our teams.
All right.
Now, we are in discussions with the Ministry of Education as to how this can be made mandatory in schools, such that at least every school has a team of first aiders and has the right equipment of first aid. And of course, and also with the places of work.
All right.
So the framework, the legal framework is there. The issue now is on how do you enforce it.
All right.
and make it happen.
Robert Kwesiga, he is the Secretary General of the Uganda Red Cross Society. Many thanks for having made the time to speak to us. Life-saving skills when it comes to first aid are really important during this COVID-19
Even
pandemic.
NTV team, you need those.
Indeed, because in the absence of the medical worker, the citizen has to pitch in
Yes.
and help that individual. Thank you very much for coming through.
The pleasure is mine.
And indeed, thank you for the good work you're doing when it comes to fighting COVID-19. Of course, we do have, yes, that is Helena Okiring. She is the Executive Director of Blue Cross Uganda, with whom we are going to expand more on the increased cases of drug abuse during this 42-day lockdown. Not only the lockdown, but